Sarah, Justine, very good to have you both with us. And Sarah, let's start with you. The story we heard at the start of today's programme, UK thwarted Russian plot to disrupt the Olympics, front page of The Times. How much of a surprise does this story come as to you?
It doesn't come as a surprise at all. Russia's increasingly just acting like a gangster state. And, congratulations to all those involved in disrupting it. It's an extraordinary story. And we should be taking much more seriously the threat from Russia across our national security and also from China as well.
Justine, when you hear stories like this, it does feel like it should really be the plot. I said at the beginning of the show, the plot of an action film doesn't feel as though it's real, does it?
No, and I think it underlines that whilst we're very focused on COVID and Brexit and the US elections, actually there's a much wider security agenda that this country is engaged in, but really matters. And as Sarah quite rightly said, we've seen Russia taking more action and more aggressive action over recent years, and I think we need to recognise what that direction of travel is, and it's in the wrong direction.
It's an interesting point, isn't it? The idea that while our focus is squarely on COVID-19, what else is happening behind the scenes? Also, a story on the front page of tomorrow's Times, Sarah, 1 hour COVID test at airports set to reopen travel. This is a story about passengers undergoing coronavirus tests before flying out of Britain under plans to open up international air travel. Is it the right time to be talking about this?
Well, I think it's the focus on air travel isn't where we should be looking at the moment. But of course, I welcome a greater availability of a rapid turnaround of tests, because this has been one of the problems from the start with test and trace, has been that it's been taking far too long to get results back. And that's really, and also we just haven't got the contact tracing right at all. It's been an absolute disaster. But I think what people should remember is that these kind of antigen tests only tell you whether you're negative at that particular moment. That doesn't mean that you can't still be harbouring it and that you wouldn't become positive within a couple of days. So I think sometimes there's a risk they can give a false sense of security. But certainly what we should be doing is focusing on making those kinds of tests available to healthcare staff and teaching staff, for example, and police forces, so key workers. Because there's a terrible story as well in the papers this week about those Care Quality Commission staff who are now going to be starting to do inspections across nursing homes, being told that they won't have access to rapid tests. Well, I mean, we know that was one of the big problems the first time round was staff moving from one healthcare setting to another and taking infection with them. So we absolutely must make sure that we're focusing on testing key workers before we're focusing on airports and people going away on holiday.
The thing is, I mean, the assumption is, and I am absolutely guilty of this, the assumption being that we're talking about people going on holiday and kind of enjoying themselves. But obviously international travel is hugely important to our economy, to our way of life, to people's families, Justine. And so actually, is it right that rapid tests should be introduced at Heathrow tomorrow to allow travellers to enter countries where a negative COVID-19 test result is required to avoid being quarantined, when as Justine said, that we're still waiting in other sectors for these tests to be made available?
Well, clearly it looks like Heathrow Airport have done this. I can imagine they're pretty desperate now to try and get the airport functioning more fully. But I agree with Sarah that one of the biggest problems we still have is we don't know who has COVID at scale. And that is disrupting our businesses. It's disrupting our education system with classes and school years having to be sent home. It's disrupting our ability to deliver healthcare because so many NHS workers are unable to promptly find out whether they've been exposed to and got this. So this has been really a huge problem within the overall COVID strategy. But then, of course, it marries up against challenges on tracing people who you might have been in contact with if you've got the disease. And I think what's worrying for lots of people is this sense that months into this COVID pandemic, we still don't seem to have enough of the basics in place to be able to actually tackle it. And as a result, the price that we're all paying is, of course, more lockdowns and a huge economic price and jobs.
The thing is, it's really easy, isn't it, to criticise the government for failing to get things in order. And I've absolutely been at the front of that queue on this programme in many times over the past few months. But Sarah, it's a difficult juggling act to do. And there must be some sympathy, mustn't there, for the government trying to keep us all safe.
Yes, I completely agree. These are really difficult decisions that have to be made. But what I don't agree with is the idea that it's either the economy or health. What we know from international experience is that those countries that acted fast and acted decisively ended up having better results for their economy and health. So I don't accept that it's either or. But the situation we're in now, unfortunately, means we could end up with the worst of all worlds, because we're seeing this dithering and delay over Manchester and are missing the opportunity possibly to coincide with the half-term holidays and have a more effective action that would save lives in Manchester.
Talking of that either or, let's turn our attention to a story that's across a number of tomorrow's papers. The Metro, I mentioned, death toll soars, but not from COVID is the headline. Also, the Daily Express act now to save hidden victims of virus. This comes as leading health charities, doctors and grieving parents have demanded action after figures have revealed a shocking rise in people dying at home in the pandemic, according to the Daily Express. And the Metro quotes diabetes victims, prostate cancer, Parkinson's, breast cancer, bowel cancer, all up shocking rates as a result of this Office for National Statistics figures looking at patients from March to September. This is really, really concerning, isn't it, Justine?
I think it's shocking, and in many respects it echoes the words of His Royal Highness Prince William that are headlined on the front page of the Daily Mail, that there are huge numbers of hidden victims of COVID, and this sense that actually we need a fuller strategy for the health crisis that we're in, which isn't just about how we tackle COVID, but actually looks across the piece at these devastating consequences that people are suffering all over the country. And we know some of them already. And of course, as you've set out, Ryan, the Metro has put out some really shocking statistics. But I think on mental health in particular, we're only just beginning to get a sense of how difficult those problems will be, not just for elderly people who may be more isolated because they've been shielding, but also for young people who've been out of school for a very long time and are probably still seeing, in many cases, school disrupted. These are the issues that I think ministers have to start looking at really carefully, because certainly on mental health, if we act promptly, then we can really stop a much bigger crisis from coming down the track. But you do have a sense at the moment that the focus is so much on COVID and the NHS is so stretched that it is very, very hard to be able to make sure that the wider health of the nation is being taken care of as much as we would have liked it to be.
Well, really interesting you mentioned mental health. The Daily Mail's front page tomorrow, William, COVID mental health catastrophe. Prince William warning of big problems ahead if lockdowns stop people from socialising. And actually a royal aide quoted by the Daily Mail is saying mental health of the nation is always a priority. But Sarah, is it really?
Well, unfortunately, we do neglect mental health. It is a great tragedy that we do that. If you look at spending from our National Health Service on mental health, it nowhere near reflects the severity and the impact on people's lives, and that's been going on for decades and still hasn't been properly addressed. We were supposed to have had parity of esteem, as it was called, but that still hasn't happened. But going back to that wider point about deaths from things other than COVID, absolutely, we have to keep reiterating that message that general practice isn't closed. And if people do have symptoms that they're worried about, general practice is open. So it's really important that people don't delay seeing their GP if they've got, for example, a lump or abnormal bleeding from somewhere, all these kinds of symptoms, because a delayed diagnosis is very serious. But not just that, I think that it's a quite complex reasons. Many people are choosing not not, for example, to go into hospital because their families can't visit them. And I think that's a worry too. And it's one of the other things that would be a positive from being able to have more effective screening of relatives, so that more families could visit their loved ones in care homes and hospitals rather than seeing them excluded. But it's easy to see why that happens, because obviously in healthcare settings you're trying to reduce the total number of people that could be coming in and bringing in infection. But it's certainly a huge deterrent for many older people that I meet who say they don't want to go into hospital because they fear they'll be stuck there and be dying on their own without loved ones being able to visit.
Well,
There are many complex reasons why there are more people dying at home. Some of them are, may of course be deaths from COVID where people haven't had a test rather. Some of them may be people who are choosing not to go into hospital for the reasons I've just mentioned, and others, very worryingly, may be people who could have been saved, but they're not going to hospital because they're worried that they'll be turned away, or they're worried they won't be taken seriously, or they're worried they're wasting people's time because the health service they've heard is too busy. But the health service is open and general practice is open. So I think that's the important message to get across, is that people should seek help.
The thing is, though, people, myself included, are scared of going to any sort of hospital or doctor's surgery at the moment, and rightly so. When you listen, Justine, to the messages that we've had from the government about what's happening, particularly the capacity in hospitals as we enter the winter season, the thought of going to somewhere where you're perhaps taking up a bed, perhaps also going into a place where there are lots of other sick people, and you've been shielding for a long time, and all of a sudden you're around other potentially ill people. How do you get past that fear?
Well, I think it is difficult for people. And of course, we've seen statistics on how under pressure the NHS is in Manchester as part of this battle, really, between Andy Burnham and Number 10 about whether that area should have a tier 3 lockdown. And I think all of this gives people, these sorts of messages that, as Sarah said, can put them off. I had a close family member who had to go into hospital recently, and it was extremely difficult for our wider family not to be able to go and visit them. It was very hard to find out what condition they were in. They had to go in by ambulance, and I think the whole experience was really deeply upsetting. Of course, nothing compared to what families who've got relatives in a care home are going through who can't see them. But I think, in a sense, it did underline this sense of, if there's any way to stay out of hospital, that I think would have seemed like a good idea. And of course, that's absolutely the wrong way to really look at this. And as Sarah says, if you do need to get help, you should be trying to access it. But there's no doubt that people have been told time and time again, and right from the very beginning of this crisis, that they need to try and reduce the pressure on the NHS. And it may be that the government does now need to more carefully modify that message. But actually, I think it's very hard for them to do that whilst we see this sort of politics steadily creeping into the decision making on lockdowns and on COVID. And I think that's part of why people are actually getting quite confused in a way about what the right thing to do is.
How do you both feel about this story on the front page of the Daily Star, also the Daily Express? Sarah, keen to hear your thoughts first. Gary Lineker pictured in a shop without wearing a mask, and this comes after he tweeted back in July, "Why would anyone object to wearing a mask in a shop? Not exactly a hardship. What a country of snowflakes we've become." Do you think it's right that papers should be putting pictures of celebrities, of politicians not abiding by the rules on their front pages?
Well, of course, I don't know the context of this at all, so I can't really comment on Gary Lineker's case. But what I do think is that there is no longer any debate that masks are effective, and so where possible, if you're going into any crowded setting, wear a mask to protect other people. And I think that we are seeing the vast majority of people now complying with that. And of course, there are some people who can't, some people with respiratory problems and what have you, who may struggle with a mask. And but for the vast majority of us, wearing a mask, and I think Gary Lineker has done a good job in trying to sort of counter some of the nonsense that there was around mask wearing in the early days. And yes, someone appears to have snapped him momentarily in a shop. But it's almost as if people are trying to sort of humiliate people who may have advocated for masks. And I don't think we should be doing that. I think the message should be, yes, wear a mask. Let's all just get behind that, because it's such an easy public health measure. So rather than be slamming people as hypocrites, I would say let's just all get behind that message that where possible, wear a mask.
Justine, there will be many people who will see Gary Lineker in a shop without wearing a mask after describing the country as snowflakes for questioning the need to wear masks, as just deserves. What do you think? Do you think it's right that he should be humiliated or perhaps highlighted in this way?
To be honest, I think most people will just see it as a story, but not really one that does anything other than juxtaposition his earlier tweet from the fact that clearly he, by the looks of it, made a mistake. As Sarah says, we don't know the context. I think more damaging is the photo of Matt Hancock in a ministerial car, because I think in the case of ministers, it is important for public confidence, especially if you're the Secretary of State for Health. And I think, in a sense, it underlines the fact that the rules come across now as so complicated, depending on what tier you're in, whether you're working or socialising. I think people do expect ministers to know what the rules are and when they should be wearing a mask. And so the Lineker photo, I think, is just one of those news stories. For me, in a sense, that the more damaging one for government is the fact that the Secretary of State for Health himself wasn't following the rules at one point. And all of this for ministers it's as much about what they do as what they say. And that's why clear messages that are backed up with action really matter.
And in this day and age, social media will catch you out. I mean, for all of us, there's something you will have tweeted at some point that will catch you out. So having to be super, super careful. I just wanted to turn our attention, talking of confusion, to the front page of the Daily Telegraph tomorrow morning. And Sarah, get your thoughts on this. Loophole puts working lunch back on menu. This is a story about working lunches being exempt from local restrictions after an apparent loophole's emerged, with meeting people in pubs and restaurants in tier 2 and 3 areas like London and York and Manchester not being allowed as part of efforts to contain the spread of coronavirus. However, Downing Street has said that apparently meetings permitted as long as they're for work purposes. This is completely confusing.
Yes, of course it is. And whenever you have any kind of regulation, you'll find somebody who pops up with a way to try and get around it. So you can call your lunch that's actually a social gathering, a working lunch. So, inevitably these things happen, and then somebody has to sort of kind of move in and stop that one as well. But ultimately, this is about people just looking at what is the purpose of this. The purpose of this is to try and look at the key ways that the virus spreads, and the key way the virus spreads is through household contact. So if people are actually calling it a working lunch when it's actually household mixing for social reasons, then actually I'm afraid they're adding to the problem.
Justine, this is where the government has come under huge criticism, because we're told that we can't see our loved ones over Christmas, but we can go into the office and spend as much time as we like sitting with workmates.
And I think it just underlines that the rules are complicated, they're confusing, people don't always understand why they work one way in one context and another in a different one. This sense that somehow you can have a work meeting with your team, and that is absolutely fine. But the minute you finish that last agenda item and then you literally crack open a can of beer to sort of have a chat with people socially afterwards, that's not. And I think this is really where it's been so hard for government and ministers to really explain. I actually think at the heart of this, in many respects, it's a bit like Brexit. Ministers have got to choose what the priority is. Is it going to be the health crisis or an economic crisis? in steering a line between both of them, they're finding it very hard to explain to people what's going on.
Sarah Williston, Justine Greening, our paper reviewers this evening. Thank you very much indeed